Newsflash, if somebody's trying to get you to buy something for cash at the doctor's office, think twice. Hi, I'm your local OBGYN. I love women, and put your wallet away. All right, so today I saw a lovely new patient. She was actually sent to me by my primary care doc physician because this poor lady is in her 40s and she showed up with some crazy bleeding that's been going on for a month. I kind of know why it happened. She just had surgery a month ago, and I think the stress of the surgery and the pain that she went through really kind of like set things to be crazy. But here's the thing. She went to a previous gynecologist who I happen to know in the community. I'm going to fry myself for this one. But this particular person has an alternative approach, we'll say. It is definitely something a little different. It is not in the naturopathic or functional medicine sort of lane. It is something entirely unique to itself. And this poor lady who had been bleeding for weeks had been given about 14,000 lab tests to do. And then she was given $200 cash worth of supplements to take. She was taking salt tabs 6 times a day, as well as crushing something else that won't even treat what is going on. And 10 days later, she's still bleeding. So the good news is that she and I share the same PCP. So her primary, who's my primary, called me up and said, like, you got to do something different because this poor lady's been bleeding and she has a vacation coming up in a few weeks and she wants to kind of like enjoy it. So she came in, and once I like sifted through all of the crap, we came up with a simple covered plan where she has to pay a small copay for what the meds are that she needs to reset the system, get an easy evaluation, and then get her on the path back to normal. So if somebody is asking for your wallet to pay for things where you can't even read the label, run.